Finding the best course of treatment for a patient can involve many things. Pharmacogenetic testing is only one of them. Even more, it can be difficult to pinpoint exactly how to incorporate the results of these tests into care, says Genxys CEO Carl Pringle. Ever since the human genome was sequenced, the concept of precision or designer medicine has been akin to a mirage. Well, pharmacogenetic testing is an important first step. That testing identifies the role your genes play in metabolizing and processing medications, and it can play a big part in supporting a better, healthier life. When it comes to medication, giving people the right dose of the right medication at the right time shouldn't be complicated. However, until recently, it's been marginally better than the trial and error process that has been the foundation of current medical practices. This, of course, raises the question: how do you incorporate the results of pharmacogenetic testing into day-to-day care? How do we put this vital information in the hands of clinicians who are your primary caregivers? How do we work with them to design a precise prescription for you and your medical issues? I invited Carl Pringle, the CEO of Genxys Healthcare Systems, to join me for a conversation that matters about the promise of designer medication and when it might actually arrive in your doctor's office. Carl, welcome.
Yeah, good afternoon, Stu. Great to be here.
This is the question, isn't it? I remember going to talks back in the 1990s. We hadn't quite, finished the sequencing of the human genome, but it seemed like it was otherworldly, and it was going to be, come along and make sure that you'll never get sick again. And if you did, we'd have exactly the right prescription. What happened? Why is it taking so long to actually become that reality?
Yeah, there's a lot of expectations around the genome and what it can do for us from a clinical perspective, but it's also vastly complex. It's complex not just from a science perspective, which continues to evolve, and the scientists understand more and more around the genome and what it can do. But the other piece of it is around patient adoption and their ability to be comfortable with having their genetic material being tested and have it. There's all sort of things that we as individuals are worried about: security, and what will that mean from an employer perspective or an insurance perspective. And then the third parameter is really around the healthcare provider and what do they do with this genetic material. Because the reality is that the doctors that we go and see week in and week out for whatever ailment it is, they are not geneticists. So for them to be slapped with a 53-page genetic report and say, interpret this and discuss this with your patient in your 7 to 10 minute consultation, isn't going to happen.
I know. They're looking at a piece of information that represents about 13 billion bits of information that become your genome. And it's no wonder. They go, okay, well, how do I know whether or not this gene lines up with that variant, with this medication and this dose and so on? So how do we start to close that gap between this massive information that we have and the delivery of that healthcare at a very real and practical level?
Yeah, and that's something that Genxys is really focused on. And when you look at the genome, you have to be focused on which part of the genome and which bit of clinical actionability are we going to focus on. And for us, it's around pharmacogenetics, which is the science of how our DNA dictates how we as individuals metabolize different medications. Because it can't possibly be the right answer that the same dose of aspirin for 9 billion people is the right dose. So that's really where we focus on. We focus on taking the pharmacogenetic piece and making that clinically useful by the doctor in that 7 to 10 minute consultation for the patient to say, okay, for you, this is the right medication, and actually it's got to be half the dose or double the dose depending on the genetic makeup of that person. But the important thing with genetics and with prescribing is that it's only one piece of the puzzle. There are all sorts of parameters that have to be considered by the clinician when they make that prescribing choice. So for example, is that patient on other medications that there could be a drug-to-drug interaction? Does the patient have any other conditions that could be exacerbated by a new medication? Do they have liver or kidney function issues, heart issues, etc. So all of those parameters have to be considered, and the reality is that there's only so much processing a human brain can do in such a short period of time. And at some point, computers are designed to take over and do that computational analysis within microseconds, and that's what we're focused on.
Okay, but we're talking about massive amounts of data here, because as you're giving off all this list of conditions, am I a male, do I smoke, what's my genetic cultural heritage, am I from Northern Europe, am I from Southeast Asia, like all of these things come into play. How do you start to get the base information that you need to be able to actually add those into the calculation?
Yeah, so there's a couple of pieces on that kind of set the rules or the framework. The first is we start from a clinical perspective. So for any given condition, what are the clinical guidelines that a healthcare practitioner would go through? And at the end of the day, what are the medications that are indicated for treating that condition? Once you have that as the framework, you then say, okay, the other piece that needs to be layered in is which genes within the genome dictate the metabolism of those specific drugs. And there are industry bodies that do the research and publish the evidence and grade it based on their evidence levels. And that's what the industry uses to provide that filter, if you will, that then enables the right answer to come out to the clinician that says, hey, you had 10 drugs to choose from. It turns out for this patient, there are only 2 that are safe and effective. Because in Canada, 200,000 severe adverse drug reactions happen 200,000 every year.
And multiple deaths.
And multiple deaths. And in fact, when you do some of the analysis, it equates to a 737 plane crashing every day of the week, every week of the month, every month of the year.
I happen to know that because I'm of Scottish ancestry, that I have a gene mutation called the MC1R gene mutation. And I'm going, I want you to know that too, and I want you to include that into those calculations, because I know that just a pain relief medication responds differently to me than it does to you because of that. And so, but I want to know, okay, well, precisely how much do I take? So how do we now take all this information that you're talking about and put it into a program that then provides useful information to your your number one primary healthcare clinician or doctor?
Yeah. So the first thing is that pharmacogenetics is clinically actionable for everyone on the planet.
What do you mean by clinically actionable?
Yeah, so it can be used by a healthcare provider to make a clinical decision. And not just for people who have a certain rare disease or a certain tumor type, but literally every human on the planet. Mm-hmm. And the reason for that is 97% of the population have at least one pharmacogenetic variant. Now, that's not to say that every person will have a medication in their lifetime that's impacted by that variant, but the chances are reasonable. And that having that genetic information usable by the healthcare professional at any point in someone's life, whether they're a toddler, an adolescent, a young adult, or an elderly care home, is going to be super critical. Now, pharmacogenetics, as I said, is only one piece of the puzzle. So it's not just about having a 50-page pharmacogenetic mumbo-jumbo report. It's about having that genetic data going through a set of algorithms that just says to the clinician what they want to know, which is the right drug at what dose. And that's what leading software today is capable of doing. And back to your very original question, which was, how do we actually make this a reality? What's the promise? Can we deliver on the promise that was made years ago around the role of the genome? And the answer is yes, but it comes back to the science is there. We now have the genetic testing capability at a price point that's affordable by most. Should be reimbursed by governments for sure, and there's a lot of work going on in that area. And now a lot of it is up to the patients to advocate for their own health. And for patients, for individuals, to go into their clinician and say, hey, I've heard about pharmacogenetics. I want my pharmacogenetics to be included every time you make a decision about what medications should be prescribed to me or not.
So I know that the Pharmacy Association and pharmacists here in British Columbia depending on which pharmacist, they offer that service. You can go in and get a swab, and they will come back having sequenced your genome from a pharmacogenetic process. But then what do I do with that? Because you're saying, okay, advocate for yourself, go get that done. But now what do I do with it? And where does Genxys come into that equation?
Yeah, and that's the third peg on the stool, if you will, is that the healthcare providers now need to embrace the technology that enables them to make that decision. And not for them to say, yeah, I'm not interested in new computational power, but just like pilots had to do, embrace autopilot capability. And our software is not designed to replace the physician. It's designed to give the physician and the pharmacist the confidence in the prescribing choices they make. So our software will take that genetic mumbo jumbo and
That's a real technical term.
That is a technical term.
Yeah.
And all the other data points around that patient, and that may come from the electronic medical record, run it through the algorithms and just present to that screen in front of the clinician, this is the right medication at this dose for the patient.
Okay, this is a software problem. It's not a diagnosis problem. How do you develop a software package that can go through that massive computational challenge?
Yeah, so for us, it all started with the vision. And the vision was predicated on the fact that we wanted to improve patient safety, increase the health of a population, and reduce the cost of healthcare. And the vision that came around out of that mission statement was we want every prescription globally to be made better by our software. So our software then, when we put our minds to it, was to take that pharmacogenetic data, take all those other data points, present it to the clinician. And actually the problem isn't so much a software problem, it's an integration problem. Because our software has the algorithms that are based on clinical evidence and clinical guidelines, but it's integrating into the electronic medical record, integrating into claims management systems that have the prescribing and medication history for the patients, integrating into a lab information system so that it brings all those data points, runs them through the algorithms, and then presents the answer, if you will, or the guidance back to the clinician in the tools that they use, which at the moment is an electronic health record.
This is quite an interesting leap forward, and I can't help but go, okay, why are you doing it here in Vancouver? What is it that Vancouver brings to this equation that makes us the right place for this company to be building this out?
Yeah, it's an interesting question, and Vancouver has a real ecosystem around health tech, and even more so around genomic companies and startups. We came out of the University of British Columbia. Our technical founder was Professor Martin Dawes, who has a real interest in pharmacogenetics and its role in community practice. And the whole ethos was, how can we make this usable? And I stepped into the company 3.5 years ago to bring it out of that sort of UBC incubator and make it a global phenomenon. And we're well on that journey and realizing our vision. But there's so much genomic-based activity around the Vancouver area. We have all sorts of support, mentors, partners. Vancouver's really on the map from a health tech genomic perspective.
So if we take a look at the work that say the Terry Fox Research Institute is working on, and their work in sort of genetic sequencing and application to dealing with cancers, does this help add a body of weight to the I guess the center of excellence around this kind of data development? I'm trying to be a Vancouver booster here because I think that you're right. We do have that center of excellence, but does Terry Fox play a role in this?
Yeah, so absolutely, all of these organizations do, and it's not just about creating that hub for the outsiders to look at and go, Vancouver's got a real focus on genomic forward thinking, but it's also about the talent pool. So and bringing new people in out of university systems. It just grows the overall tech hub. And you go back to our founding fathers of Genxys, if you will. Peter Cullis is one of those, and Peter Cullis, heavily involved in the mRNA, and he's He's a world phenomenon himself, and his fingers are all over the blueprint, if you will, the DNA of Genxys.
So you started as an incubator at UBC. Where are you at now? What's the size of your team, and where do you go from here?
Yeah, so we've got a team of 18 professionals. Many of them are health professionals, and I'm not, by the way. My background is software, taking innovative software organizations and making them brand leaders in their chosen markets. We're very focused at the moment on the North American operation, so we're live in Canada. We're operational with users in and across the United States, and we've got a clinical study that was very successfully completed recently in Singapore, and we've got some conversations going on in UK.
So there could be a couple of potential audiences for this interview right now. One of them would be clinicians. What do they need to do to be able to start to benefit from the work that you're doing?
Yeah, so they need to do a couple of things. The first is they need to do a little bit of education around pharmacogenetics and the importance to them in their prescribing habits. The reality is that litigation in the US will soon follow. I'm sure of that, because as more and more evidence around pharmacogenetics comes out, and if it's not being followed by practitioners, you're sure that litigation suits will follow. So it's going to be to their benefit to educate themselves. The second is they need to look at ways that they can utilize the pharmacogenetic data in a way that doesn't hinder their time with the patient or interrupt their workflow, and that's got to be embracing software. So I would ask them to go to www.genxys.com. And a lot of work is also being done by the genetic lab companies. So these organizations that are actually doing the genetic tests themselves. Mm-hmm. And the interesting thing with pharmacogenetics, and this is important for any individual out there, pharmacogenetics doesn't tell you your propensity for getting a specific disease.
No.
Or dying tomorrow of something.
It's about drug interactions.
It's purely about which medications are the right ones for you. Mm-hmm. And I am pretty certain that during the course of our lifetime, every baby at birth will have a pharmacogenetic test, and it will be in their own personal pharmacogenetic locker, if you will, on their mobile device. So it doesn't matter whether you're on holiday in Miami and you get hit by a bus, you need a prescription, your pharmacogenetics is going to help you get the right drug.
Okay, hang on a second. I got a question for you, though. I'm of the understanding that through epigenetics, our genome is constantly evolving based on who we are, diet, lifestyle, environment, and so on. Is this something that you need to update?
What needs to be updated is the evidence around which genes play a role in medication selection.
Right,
and that's important from a software perspective. You don't necessarily need to have a new genetic test.
Right.
What needs to happen is the software being used to interpret it is being updated to take into account the latest scientific advances and evidence being used.
So, your doctor may be one point of contact, but because we're talking about the right dose at the right time, pharmacists play a very, very important role in this. And so how important is this as a tool for them as they move forward in fulfilling those prescriptions? And we also see pharmacists now, their responsibilities are increasing. There's a doctor of pharmacy that is available. These people have the ability to also prescribe, and increasingly so. So this will be a valuable tool for them.
Yeah, pharmacists are a really important piece to this overall problem of getting the right medications to people. And part of that is because of reimbursement. Pharmacists are reimbursed for doing medication reviews. And you think of that 85-year-old lady that comes in with a Ziploc bag full of 14 different medications she's taking on a daily basis, right, and says to her pharmacist, do I need to take all of these? And think about having to go through that in a manual process. It takes hours to consider all of the different variables. Now think about overlaying that process with software wizardry that says, oh, actually, you know what? Drug B, because of your pharmacogenetics, should actually be a different drug. And if we replace it, then we don't need drug 4 and drugs 5 to deal with the side effects. So all of a sudden, you have a mechanism for pharmacists to do medication reviews, deprescribing, medication rationalization, whatever you want to call it, in seconds rather than hours.
Right. You're addressing polypharmacy in essence, right? Because this is a big issue. Okay, you've been taking that medication for 20 years, and it just builds on one on top of the other, but you don't need it any longer. But who's going to be able to tell you that you've got to step off of it? I think it becomes a very valuable tool for so many people.
Totally. That polypharmacy angle is really important. And we're actually seeing pharmacists leading the charge around the role of pharmacogenetics, partly because they have the time as well. And our solutions enable the pharmacist to have an objective dialogue back with the prescribers and saying, hey, I've done a medication review. Here are my notes. We actually even incorporated pharmacogenetics. Here's some areas of drug switching and drug deprescribing. And we're seeing some real value coming into the healthcare models because of that. And what we need in Canada is we need the government agencies to really embrace the role of pharmacogenetics. And there's enough evidence out there to say, hey, we don't need to do another study. What we need to do now is actually get it in the hands of the clinicians.
Well, that may be your biggest roadblock, because getting administrators within the healthcare system to say, okay, I'm going to take that chance, becomes challenging. And so then what role, because you talked about patients advocating for themselves, what role does that patient advocacy play in helping us move that objection or concern out of the way so that we do get access to this kind of valuable information?
Yeah, so there's a few things. So first of all, for us as individuals is to go to maybe our insurance company, our brokers, our employers, and certainly our healthcare providers and say, I'm interested in pharmacogenetics. I think it's going to play a role in my personal healthcare. That is of absolute importance. And we're already seeing insurance companies in Canada, like Green Shield Canada, for example, who have said, we are going to offer pharmacogenetic testing at zero cost to certain populations of their members. Because they know, and of all the industries out there, insurance companies have reams of people with very thick spectacles that do a lot of modeling around the benefits of their offerings. And pharmacogenetics is no different. And they know that there's a real return on investment for patients, particularly those with mental health conditions. Those medications are excellent at what they do. They're very powerful, but they also have high levels of pharmacogenetic variant.
So just to quickly wrap up, website where people can get information is?
www.genxys.com.
Wonderful. Thank you very much. It's informative. I'm happy to see this happening here in Vancouver, and that this moves us towards that promise of precision medicine.
Thank you.
Thanks.